To assess blood pressure, you will need a stethoscope and a sphygmomanometer. The patient should be sitting upright with their back and arm supported. The patient should also have their feet flat on the floor and uncrossed. The arm used for the assessment should be bare. Be sure the patient has not ingested caffeine or nicotine 30 minutes prior to the assessment. Make sure the proper cuff size is used or you will get an improper blood pressure reading. Be sure the earpieces are facing outward on the stethoscope and the stethoscope is on. Put the blood pressure cuff on the patient's arm aligned with their brachial artery, which is on the inside of their arm. Make sure to place the cuff nice and snug on the patient. With the patient's brachial artery, be sure the bulb of the blood pressure cuff is closed to the right or to open to the left. Before using it, make sure it is closed. Place the diaphragm of the stethoscope on the patient's brachial artery. Be sure not to place it underneath the cuff. Inflate the blood pressure cuff to 180 to 200 millimeters per mercury. Slowly release the valve to the left between 2 to 5 millimeters of mercury per second. The first thump you hear is the first quarter cough sound and is the systolic pressure. The last quarter cough sound you hear is the diastolic pressure. This patient's blood pressure was 136/78. Be sure to wait 3 to 5 minutes before recording a second measurement.